Courtney Wolk. I'm the director of PISCE, and I'm here with Danielle and Molly. Maybe I'll let you both introduce yourselves really quick, and then we'll talk about what we're going to talk about today. Danielle, do you want to go first?
Sure. Hi, everybody. Danielle Cullen. I'm a pediatric emergency medicine physician at CHOP and an implementation scientist. I'm also the director of education for PISCE. So if anybody has any questions about the certificate program or educational offerings, please let me know. And I'll pass it over to Molly.
Perfect. Hi, I'm Molly. I'm a clinical psychologist over at CHOP and an implementation scientist as well.
Great, thank you. So the idea for this discussion today, and it's really, we hope it will be more of a discussion than a formal presentation, but we've had amongst some of us that are presenting today, amongst some members of the PISCE team, we've had various conversations about just how complicated some of the projects that we do are in terms of the number of partners, the number of implementation strategies, adaptations to interventions, things like that, and are often sharing with each other different tools and resources that we use to stay organized, to manage those things, and also to organize things in a way that it's then easy to disseminate and share the work that we've done with others in the field. So we thought it might be fun to get together and to share some things that we use in our own work for various aspects of our implementation science work, and also to have a discussion with you all about potentially other things that you all use in your work so that we can all share and learn from each other. This is not meant to be an exhaustive discussion about all the sort of tools and methods for tracking and managing implementation science projects by any means. There's tons of stuff out there. We just wanted to share some of the things that we tend to rely on the most or have found particularly helpful, but then would love to also hear from you all other things that you use and like and would recommend. So we'll talk a little bit about some tools we use for selecting, specifying, and operationalizing implementation strategies, tracking adaptations, some techniques that we've used to make group work a little easier, to facilitate participation in group work, especially in a virtual environment. And then we'll have time to discuss and share other resources amongst the group as well. And just a quick note that Molly has to leave about halfway through for another commitment. So if you have any particular questions for Molly after she presents on her implementation strategy tool, throw those in the chat and she can respond as best she can, or we can follow up by email with any additional resources or information. But Danielle and I will be here for the hour. And I know we have some other folks from the PISCE team here as well. So really looking forward to our discussion. So we wanted to just sort of orient you a little bit more to why we wanted to do this. And as I mentioned, it's because the work that we do in implementation science does tend to be quite complex. So even in a single study, we're often testing either multi-component packages of implementation strategies or multiple implementation strategies at the same time. We're often thinking about or needing to make adaptations to the interventions that we're testing or implementation strategies that we're using. And in doing this work, we all strive for it to be really partnered and to have lots of opportunities to integrate the voices of people with lived experience and our community partners and health system partners in our work. And doing that, especially when meetings have increasingly become virtual, can be challenging, and it can be hard to think about different ways for making sure that everyone gets a chance to contribute and that everyone's contributions are able to be sort of equitably shared and discussed and incorporated into decisions. So those are some of the things that have, led us to have internal conversations about, how we do that on different projects, what our colleagues are doing, what new tools are kind of coming through in the literature. And so we wanted to share some of that with the rest of the team and also learn from you all. The reason for doing this is, one, we want to make sure that the work that we're doing is systematic, that we're able to disseminate with a lot of detail and rigor.
Rooms are just so hard to come by.
Yeah, they are great.
Can we mute? Thank you. We wanted to make sure that we can disseminate the work that we're doing so that if we're making adaptations, if we're developing implementation strategies, we can really specify them in a way that others can then learn from and replicate, because ultimately that helps us advance the field. So keep all of that in mind. That's sort of some of the things that led us to this meeting today. So we're going to start with implementation strategies. Danielle, I think you were going to talk first about implementation strategies. Did you want to take this or do you want me to jump in?
Absolutely.
Great.
So I see Dr. Katie Hoskins on the line right now. This is an image from one of her papers on implementation mapping, which I just think is a really great stepwise approach to the definition and selection of implementation strategies, so supports and adaptations that help other people do the thing. Oh, thanks, Chris sent this paper to a mentee today. So the information about that paper is at the bottom. But just to orient everybody to the concepts here that, like Courtney was mentioning, in a lot of our work, we are working with tons of different people and groups of people in order to understand what are the barriers to doing our evidence-based practice and selecting the types of strategies to support them. Implementation mapping has become one of those really common or more hot topic methods of doing this. But even as you go through all of this process, you may develop a list of about 40. I think Katie in this paper defined 39 different potential implementation strategies. And then we're left with the decision of, but if you click one time, Courtney, which are the ones that are going to have the biggest impact for you? How many should you choose? And which ones are really going to be reasonable to use? So one method for this that we developed within a project of ours, if you go to the next slide, is to build into our matrix where we are defining the types of implementation strategies aimed at the barriers that we've learned about in facilitators through the contextual inquiry and implementation mapping, this scoring of both impact and effort. So where it is that I really want you to focus is on that purple bar. So we built out through all of our sites. This was an education-based project across 7 different hospitals and healthcare systems. And we created a compendium similarly to Katie of about 40 different strategies. But before getting to the protocolizing portion of this, we numbered all of the strategies and then asked each site, similar to what Laura Ellen is putting in the chat with a PISCE criteria, whether things are affordable, practical, appropriate, etc., of all of the letters, but to rank these on a scale of 1 to 10 in terms of, or 0 to 10 in terms of anticipated impact, and 0 to 10 in terms of anticipated effort. And we then built these cells so that they would automatically populate, if you click one more time, into an effort impact matrix on the same Excel spreadsheet. So based on those scores, they would go into these boxes where we could see that green quadrant as our easy wins of high impact but low effort, and our light blue of those that have high impact and maybe higher effort but would be worthwhile. And then that red quadrant, meaning this is going to be high effort, low impact, don't even go there, and yellow being somewhere in the middle as well, where they may be easy things but with lower impact. So this is a tool that was helpful for us to determine if there were patterns within those sites or across all of the sites where we could define our core group of implementation strategies that we wanted to use.
Awesome. Thanks, Danielle. And if anyone has questions about that for Danielle, feel free to throw them in the chat. And then Molly is also going to talk a little bit about implementation strategies. Do you want to kick us off, Molly?
Perfect. Thanks, Danielle, for starting us out on strategy. So this tool was created based on kind of existing frameworks for strategy specification and kudos on this really goes to my colleague Brittany Rudd, who led the efforts regarding kind of compiling different approaches to strategy tracking to create this pragmatic tool. This tool actually originated as something that was meant to help clinical researchers, so effectiveness and efficacy researchers, specify their strategies kind of earlier in the spectrum, thinking there's all sorts of strategies that get used before we get to the kind of implementation, science stage, and could we capture those and then know what our evidence-based practices really take to implement when we get sort of down the road. But we also have articulated in the paper about this tool that this could certainly be a tool for implementation researchers as well. And so I certainly have used it in a variety of projects. This particular snapshot, though, is an example of using it in an efficacy trial just to really capture the naturally occurring strategies that are happening baked into the trial. So things like providing supervision or assessing readiness and all sorts of things. So we've used this as a periodic tracking system to see from study planning through the full implementation of the trial, like what strategies we're using at different times. So you can see that this tool maps onto different ERIC strategies, how we define them in this particular study. And then the parts that are cut off are in the article that I can link to in a moment, but are kind of specifying things like what's the action related to the strategy, who's the actor, like who's implementing the strategy, what's the dose of the strategy, linking it to clear implementation outcomes and justification for using the strategy. So it's really this methodical sort of step-by-step of like, what exactly did you do related to this strategy and why? And so there's all sorts of different categories that go along with that. Again, I'm happy to put the link in the chat. So even though in this particular situation, this is capturing, okay, this is an efficacy trial, like what are we sort of doing anyways to get this off the ground and keep this moving? I think that, given that it draws on Proctor and some of Persaud's work, I think that it's very applicable here to just any implementation strategy tracking that we might do to really see over time within a study what kinds of strategies we're using and how we're defining them and operationalizing things. So happy to answer any questions or for us to kind of move to the next piece.
Awesome. Thanks, Molly. If anyone has questions for Molly, feel free to throw them in the chat and we can take a pause to discuss before she has to go. But yeah, thank you for sharing the article in the chat in a moment, Molly. The thing I really like about this is it aligns so well with all the recommendations in the literature for how to specify and report implementation strategies. And so if you're doing this throughout your study, it makes it just so much easier at the end when you're ready to write up the paper to really clearly organize and report everything that you did, because as you can see, there's just a lot of detail here and things that you might naturally be doing as part of your work and not necessarily even thinking about if you're more on the like efficacy effectiveness side of things, not even thinking about tracking in this way. So that's great. Thanks, Molly. The next one we wanted to talk about, and I just wanted to make sure there's not any questions. Perfect. The next one we wanted to talk about is the frame, which many of you are probably familiar with. This is just really handy whenever you're doing adaptation, either a intervention adaptation or implementation strategy adaptations. So frame initially was developed for specifying and tracking and reporting adaptations to interventions. And then a couple of years later, they came out with a version that's really similar, but that's oriented towards documenting any modifications to implementation strategies. So either or both of these might be relevant to your work, depending on what you're doing. We certainly found that this is a helpful tool in a lot of our projects. And we've ultimately been really glad that we tracked things at this level of detail because it made it much easier for us to report some of the adaptations that we made when we got to the place of sharing our work at conferences or in papers. So the frame, if you're not familiar, there's two papers here that describe the tool. And then there's also a lot of resources on Shannon Wiltsey-Sturman's lab website, including downloadable Excel spreadsheets for tracking all of your adaptations aligned with FRAME and FRAME-IS. So there's a link and a QR code to that website if you haven't explored it. Definitely check it out because there's no need to reinvent the wheel. You can take some of the existing spreadsheets that they've already developed and use them or modify them if you need for tracking adaptations in your own work. And so we've used this a lot, and I'll share a couple of examples from a couple of projects that we've done just to kind of show you what it has looked like for us. So we always start with filling out sort of this really detailed spreadsheet version that we can get from their website. But then ultimately we often translate it into like a slightly more digestible, less detailed form for publication or for conference presentations. And so this version here is from a paper that we published around adaptations and implementation planning for the rollout of a school mental health consultation model called Bridge. That's work that we did in Philadelphia schools. And so as part of the process of preparing to roll this model out in Philly, we worked pretty closely with the treatment developer and along with some target end users and community partners to really identify and make adaptations to the model and to the plan for how we were going to train and implement it in Philly in order to sort of maximize our chances for success. And we recorded all the details in a pretty detailed way using Frame. And so this ultimately ended up in the paper. So we organize our intervention adaptations into preparation and implementation phases. So here, for example, you see that we made a modification to the content in which we restructured some of the record forms that are in the initial sort of intervention package to make it more feasible and to fit within the workflows of the ultimate sort of end users in Philly. So we were working with people and they were giving us feedback that like the way that the forms were set up in the manual just maybe weren't as conducive to the work environment that they were working in, and also that some additional structure would be helpful. And so just to make it concrete, like this is what the record form in the original sort of protocol for this intervention looked like. So mental health clinicians go into classrooms, they do observations, they take notes on this form, they're taking notes about what they're observing the teacher doing, what they're observing the focal student or students who are on their caseload doing. And then the idea is that they take these and use them to develop their sort of detailed consultation plans with teachers. And what we found and what we heard from our partners was that this was just kind of an overwhelming format for them. They didn't quite always remember or know what to include. They were so busy that details were getting missed. And so we worked to create a more structured version. So we kept the sort of content areas the same, right? Notes regarding what you see with the teacher, any notes around the focal student, but then we were really clear about what the different categories were and what types of things we would want clinicians to be looking for in those domains. And then we developed like a yes or no scoring system, as well as having opportunities to leave notes. And this just made it so much easier when we got to the consultation phase for us to work with clinicians to say, okay, what's going on in this classroom? What are areas of priority? Let's go back to your notes and see what was a specific thing that made you say like this was strong or not strong in your ratings. And so that was just one sort of concrete example of something we adapted. Similarly, during the implementation phase, we did some work to make it easier to sort of scale up and increase engagement across schools. So the original package of the intervention and the strategies that had been used in the past for implementing it didn't really include a lot of educational or informational materials beyond sort of ones that were really clinically focused for the clinicians being trained. And so we found that in our work, we really needed to develop more of those. So we developed some really targeted handouts explaining what the model is. We had versions that were targeted to teachers and principals. And so that was just kind of how we captured that aspect of what we were doing as we were tracking things. What you don't see in this in this column here, but for our own internal records is when we do this, when we're doing it in like an Excel spreadsheet, the messier version, the more complex version, we're also including hyperlinks or details about page numbers to where we can find the specific adaptations, either on our shared box folder that we're using for the project, or in the, if we're making modifications to the treatment manual, what page are those on? And that just helps also with being able to find and organize these things and share them with others easily. And then I think the last one is that as part of our kind of scale up activities as well, we develop strategy briefs to make it easier for the clinicians to teach the teachers the strategies that they wanted them to implement in the classroom. And this ended up being necessary in our context because the clinicians we were working with just didn't have the same sort of theoretical background and training in the underlying sort of principles of the evidence-based practice as the clinicians who had been doing this work in previous trials had. And so we needed to sort of bolster some of the resources that we had available for them and just make it easier for them to have things that they could kind of off the shelf convey to teachers. So within some of the different domains, we made these strategy briefs with specific examples of what implementing this particular component of the evidence-based practice looks like, strategies you might implement class-wide versus in a targeted way. And then this gave the clinicians something really concrete to go through with the teachers and to make sure that they were sort of conveying the information with fidelity instead of relying on sort of their previous training and exposure to be able to do that more verbally, which they needed more support with. So that I think wraps up frame. Happy if there's any questions about that or about adaptations to talk about those. And then also, as a next step, we can kind of move on to group work, but I'll pause there for a second and just see if there's any questions coming in the chat, or if anyone wants to unmute and share any questions or thoughts on anything we've talked about so far, especially before Molly has to hop off. No? Okay. So the last sort of chunk of things we wanted to share about pertains to group work. So we have found ourselves, especially since COVID, doing a lot more virtual meetings with our community partners, doing a lot more virtual advisory board meetings for studies that have ongoing sort of engagement of an advisory group or a partner group. And so we've experimented over the years with different technologies, and many of you might be familiar with these. You may have used them in your research. And maybe you've used them with your partners or with sort of engaging your different collaborators, but maybe not. And so we thought we'd share some ways that we've done some of these things. So digital whiteboard tools in particular tend to work really well for virtual like Zoom or Teams meetings where you're trying to collaboratively make decisions, elicit input from different collaborators, and do it in a way that gets everyone an equal chance to participate and contribute. So it minimizes opportunities for like one person to maybe monopolize the discussion. And it's also really nice because you can be in real time with your partners, organizing and refining things together, and you can kind of see it all happening on the screen, which makes the back end work of like synthesizing the discussion much easier. So one that we've used is Jamboard. So this was from a project in which we were doing partnered work with an advisory board of school leaders and counselors and school mental health team members to make adaptations and plan for implementation of a team training intervention in the school mental health context. And so we did this barrier identification and prioritization activity. We used a 4-quadrant method, which will look a lot like what Danielle shared with you earlier. And we did it in a virtual meeting using Jamboard. So we broke up into small groups and had each group sort of do this work independently. And then we came together and sort of merged the findings across the different groups. But what we did is we used sort of these virtual Post-its on this collaborative Jamboard platform. platform. And so everyone gets a link to the Jamboard. They can open it on their own screen. As we're sort of in this meeting together, people can be pulling up their own little Post-its in their own color, writing thoughts they have about concerns or barriers or things that they're afraid that might get in the way of success for the project. The actual content's not necessarily important here on the screen, but everyone can be doing this simultaneously. So you can watch sort of the Post-its, the little squares sort of pop onto the screen as people are contributing ideas. And you can just continue that process until everyone's had a chance to contribute. And then there's usually a step of sort of reconciling times where people have shared really similar or the same thing on different Post-its. And so if you have multiple ones that are really overlapping, you can sort of move them together, organize them on top of each other, and you can end up with a final set of barriers or challenges that you can then sort of prioritize for discussion. And so once we had done that, we then did this 4-quadrant little matrix and moved them collaboratively into the different quadrants. And so we had people, we talked through each one and talked through how likely is this to get in the way of our success in this project? Like, how likely is this barrier or challenge to occur? And how impactful would it be if this was a problem? Like, is this going to destroy the study? Is it going to sort of just, make it impossible to continue? Or is it like, this might happen, but it's not going to be the end of the world. Like, we know how to sort of work around it, or we have some ideas. It probably wouldn't totally ruin the project or derail things. So again, we did this sort of sorting process collaboratively. We talked through each one, made decisions about where to put it in the matrix, and then we could bring this back to the larger group and compare it with what other groups had done, and then create sort of a final collaborative version. So for us, this has been a nice way to give everyone a chance to contribute and share thoughts or concerns they have going into an implementation project, so that we could plan accordingly and prioritize our implementation strategy and our implementation planning development work accordingly, based on the things that were most likely to be a concern to our partners, most likely to have a negative impact on our study's success. And then we could, really focus our efforts strategically around those. And then Danielle, I think you have an example to share from your work.
Yeah, this is an example from work that's ongoing right now, less in the working collaboratively to develop ideas and kind of synergize those ideas, and more to keep everybody in a shared mental model. So what you see here on the top of the screen is just an example of a classic Gantt chart for our study timeline, with lots of colors, because many of you know me on this call, and there will always be lots of colors in everything that I do. But what we're able to do here for shared mental model is that we move that purple star that you see along the train to show where it is that we are. What you'll see below, and this is an example from Miroboard, I can't remember if I said that out loud, but just to show in contrast with Jamboard, we also, since you see that we're in the contextual inquiry phase of implementation mapping for this project. So below we have all of the meetings across the 3 different sites of our project that we're conducting. So whether that is document review or focus groups or interviews. And within Miroboard, you can create a number of these different rows and columns. So we have the columns divided. I recognize that this is zoomed far out, but the columns indicate months, the rows indicate sites. And then within each one of these meetings, we could demonstrate who that meeting is with, what stakeholder group, as well as if it's scheduled, if it's planned, if it's unscheduled, or if it's occurred. Within each one of these little boxes, you can also click them open, and that's on the next screen, where you can indicate within these boxes who that meeting was with, what the date was that it occurred. I have that little thought bubble there, or speech bubble, just to cover up the names of the people who were in that group. But since this portion is, non-human subjects research. We have the documentation of the folks that we've spoken to with an overall summary of that work. And if your data allows for this, then you can also link this to wherever it is that you're storing your audio files, your rapid qualitative analysis, whatever the case may be, in order to keep all of that information linked and track it over time. So this is something that's been helpful to us.
Thanks, Danielle. So those are the things that we wanted to share with you, but we also have lots of time for discussion. So I'll stop sharing in a second and would love to hear from you. Any of these tools that you've used before or think might be useful in your work. What other tools have you used or what have you done creatively to sort of manage complexity in some of your implementation work? And also any thoughts about what more is needed? Like what are your pain points where better tools, better resources, better systems would help you in managing the complex work that you're doing in implementation science? And maybe we can put our heads together because maybe someone else knows of something that already exists, or maybe there's a motivated person who wants to develop something. So I will stop sharing and would love to open the floor to discussion for any other thoughts people have. Um, Let's see, Greg, I see your comment about stakeholder mapping and analysis. Would love to, if you're open to it, would love to hear a little bit more about some of what you've done if you think, if you might be open to sharing with the group.
I'm happy to say, I'm trying to chew up too much of time here. So the work I do generally is around leadership and leadership of organizational change, and particularly often in medical systems, but certainly not exclusively. And as you, anybody who's lived in a healthcare delivery system, let alone an academic healthcare delivery system, they are stakeholder-rich environments. And so to me, I think one of the misperceptions about change is somehow it's not about consensus. It is not. There is no social system that doesn't have somebody who has a vested interest in keeping it exactly the way that it is. So that means when one does stakeholder work, it's about forming the coalitions you need to create critical mass, because that's what you need to get things started, get the train moving out of the station, et cetera. So doing that work is part and parcel of trying to get changed, decide if a change effort can work, and if you're unsure, where you should focus your attention. So the grid you put up there is not unlike grids that I use, and that's in no way to discount them. I think they're very useful, and I think this one is a good one, particularly because it's scaled and you can get some sense of it. Uh, but I think that the key part about stakeholder piece, even around project work, the type you're talking, is that it is a political event. In addition to the other things that it is a political event. And political events are about coalitions and they're about critical mass. And it's about getting enough of that together, not all of it, but enough of it together to pull it, to get it started, to maintain it, to get it to happen. So that would be the orientation. And then there are different ways that one can try to approach that. And then there's a whole set of skill sets inside that training and thinking and that can help one get that coalition together and to maintain it. So that's about as fast as I can do that, Courtney. But
That was great. No, thank you for sharing that. I think that makes a lot of sense and is really important. And if there are any other sort of papers or tools you think that people should review on this topic or things, feel free to pop them in the chat. But I think your point is really well taken, and I think it also sort of connects with Christina's comment a little bit about sort of during that process, how do you keep track of when opinions diverge or why certain decisions are made? Because you're right, like you're not always going to be able to appease everyone, and so I do think documenting that is really important. Do you have any thoughts about how you do that?
Well, I would think that one of the things, to just build off something you just said, Courtney, is that I encourage people, and this is particularly, I think, challenging for people who like to believe the world is a rational, science-based place to work in, right? And it is some of the time. But But if you're trying to do, even when you're trying to do good field research or good science research, um, it's you need to have an ongoing, as that the process presented here, an ongoing attention to, because it's not a one and done process of where are we in this, right? And just keeping that shelf space alive in a disciplined fashion helps you do the thing you really want to do, right? Which is to get the science to advance what you know about whatever it is that you're trying to find out about. So I think it's developing and maintaining a disciplined way of having that in your mindset without having it flood the rest of the field, but it needs to be there regularly and returned to regularly. And as they say, it's not why you went to medical school, right? For those who win, it's not why you did it, but it's important to get the work done that you want to get done, and it's not one and done. It's an ongoing attention to, right? So,
Yeah, I completely agree. Thank you for saying that. Let's see, Laura Ellen, I saw your hand first, and then Christina.
Yes, thank you. I love all these tools, and so I know Danielle and Courtney, I emailed you, but I'm gonna plug anyway. So I am leading a research topic on this very thing of what are the tools that we use in implementation science research and scholarship that if you're not connected with a group such as PISCE or when I first started, Renad was still at Penn, right? And if you're not connected, with someone like Renad, who's been doing this for, hundreds of years seemingly, right? Like, how do you get access to these tools? And also, right, many of us here in academia, we need to publish papers in order to progress in our careers. And so we're attempting to do two birds, one stone, and that's what this research topic is all about. And so, um, if you have these ideas that have not been published already, certainly you should cite them if they come from other people. But new tools, new ideas, and things that you have found to be particularly helpful, that's the exact kind of thing that we are looking for in this research topic. And so anyway, I would just encourage folks, there are deadlines, they're a bit artificial. And so if you know that you're wanting to submit something and you can't quite meet the deadline, just let me know and we can work with you. But that's my very shameless plug that you submit something to a thing that I'm working on.
Thanks, Laura Ellen. I was hoping you would tell everyone about that because I was remembering it as I was talking. So thank you. I think that'll be such a nice contribution to the literature. Christina, I see you have your hand up.
Hi, and thank you, Laura Ellen, for sharing that because I don't know if anyone else is submitting to the CIRC conference, but I'm putting together something and I think it actually would be a really good fit with this. And it gets to the point of around these, going back to the collaborative processes, and I don't know about all of you, but really trying to be really intentional and thoughtful about, the power dynamics when you're engaging with diverse arrays of community partners. And just, I feel like that gets kind of muddled when we go to write these things up of, yes, we had this great collaborative process and we made these decisions. At the same time, it seems like, those decision points are not always articulated very well. And oftentimes I feel like we've been guilty of this, of just defaulting to what the more academic team thought would be better. And so I was just curious if that is a pain point for others and how we might just surface that a little bit more, because I feel like that gets glossed over a lot in terms of, and Greg appreciated your points on that as well.
Thanks, Christina. Yeah, that's a great question. I'm curious if anyone else has particular ways that they've approached this that they want to share. I know we have some ongoing PCORI trials amongst the group and that sort of piece around shared decision making and partner engagement is always I think a lot more detailed in those proposals than in some of the other proposals that we write. And so if any of you have thoughts about what you're doing and some of that work that you want to share or others, I'd love to hear it.
I'll share very briefly that the concerns that you raise are so valid, and I imagine experienced by everybody in this group. So you're not alone in that at all. I've also found that recently, some of the drivers, especially when there are these group conversations involving people from multiple different sites, some that are more academic versus less or bigger or smaller, that some of the tension that's felt, or even ways in which people may express things, is also because everybody's busy and some people are forgetting what it is that we're doing. So I have found that creating infographics to help keep everybody on page and reoriented to our previous conversations of this is what we've already discussed in the past, if anybody's missed a meeting or has some red notes, and these are the must-haves or the would like to haves or the must-dos, has been useful. Doesn't solve all of the problems that you're bringing up and some of the tension, even based on who takes up the air in the room. But I've found helps keep people a little bit more unified in a way.
Thanks, Danielle. Yeah, I think the other thing that I think can be really helpful is trying to be as proactive about these discussions and processes as possible early in the work, and making them really explicit and in writing so that everyone is on the same page. And so if there are sort of disagreements later, or people sort of are straying a little bit from the mission of the group and what you're trying to do, you have something concrete that everyone's seen before that you can refer back to. So we tend to write out, like, we've called it different things, but like a charter or a mission statement or something for our advisory groups, for our research team, which includes our, patient partners and whatnot. And we try to be as proactive as we can in thinking about and developing and writing out a process about how we'll make decisions. And the goal is always through like consensus discussion when possible, but that doesn't always lead, not everyone's always going to end up in the same place. So having a plan for what you're going to do, whether it's like a democratic voting system or something, who's going to lead that, how are you going to document and record any sort of dissenting opinions, or sort of the rationale for why the decisions were made. As much as you can proactively think about how you want to do that, put it on paper, agree to it, discuss it in the beginning, then I think it just makes it easier when you have to sort of go back and actually implement some of those processes when you are sort of not easily coming to consensus. But that's just something that we've been trying to do more intentionally. Let's see. I see comment from Mari about are any tools free for Penn employees, or only those available for your people affiliated with the university? So the Frame and Frame IS, all of that stuff is on Shannon Wiltse-Sturman's website. That's all free. Anyone can access that. The implementation strategy documentation tool that Molly shared, that Excel spreadsheet for that is in the supplemental files for the paper that she shared. So that's all available. The ones that can be a little trickier are like your Jamboards and Miro boards and stuff like that. And I don't know offhand exactly what is free and available. And I think it depends a little bit sometimes by school too, what you have access to. But when we use them before, even if we've had to sort of buy like a monthly or like short-term sort of plan to use it, they're not too bad. And so if you know you're going to be using tools like that, you can see what's available. A lot of them have similar functionality. And if you need to pay for something, if you're able to sort of plan proactively and put that into your budget for your project, that's ideal.
Thank you. Yeah, we're still trying to find like a tool that works best for everyone. Some people prefer Trello and some people prefer other things. But unfortunately, things, for example, like using Penbox, it's only available for certain affiliates. So it's a little bit more complicated than that.
Yeah. Yeah. There's not like there's not a lot of things that work well for everyone. Yeah, Zoom has a decent whiteboard. That's right. Thanks, Laura Allen. Looks like Rachel has used the free version of Miro board well. That's great. We've used the free version of Asana for project management really effectively too. So that's another one if you're looking for something more like project management-y. But yes, it's always changing too, like what's available. So Figma, yeah. Lots of love for Asana. We're big fans of that too in our group. Awesome. Let's see. Katie, I see your question. Not sure if it's easier. Do you want to unmute and just say what you're thinking? Would that be easier?
Sure. Hi, thank you. This is like so helpful. I know Danielle and Courtney, we've chatted about this topic before quite a bit, but I guess what I'm curious if folks have ideas. So I'm in the middle of planning for a hybrid type 2 study in which we're testing the effectiveness of a program, but we also kind of have a kind of a pilot study of our implementation strategy package embedded in the larger effectiveness trial. So as I'm doing implementation mapping right now, I'm trying to dig into kind of adding on to kind of Proctor's specifications, like really thinking about like form and function and mechanism specifically. And what I'm finding is that a lot of the strategies have different forms. So they're packaged in different ways. So like my educational materials, I have a one pager for our nurses. That's a kind of a physical back and forth. But I also were developing kind of Instagram posts. So those like the functions and the mechanisms are the same, but the form looks different. And I'm trying to figure out a way to try to capture that and kind of document that, planning to document that longitudinally over the course of a trial. And I'm finding that like my spreadsheet just like keeps getting bigger and bigger and messier. And it's getting harder for our team to access as I've tried to put it together. So just curious if there's other tips. I've never used FrameIS. Is that something I should be thinking about using? Because it's not necessarily a adaptation or a modification. We're just having different packaging of the strategies. So curious if anyone has any tips.
And Katie, you want to use that to sort of archive the different artifacts, like all of the different posts and things like that?
And to really, yes, and to also to be able to track like what we're doing over time over the course of the study as well.
Yeah. Yeah, I mean, we don't have a great way to do that. We've done something similar, just honestly, with a slide deck with dates, so that way you can sort of page through it, and it would probably work well both with the materials and certainly with the Instagram posts. But I don't have like a better way. I mean, you could, if you wanted it to be more in a database, you could make a red cap where you upload, images and things like that of the posts that would be an even more, perhaps robust and a lot more difficult to like accidentally delete one of the posts or something like that. But I don't have a better solution than that.
Yeah, it looks like Laura Ellen was thinking Qualtrics. I had the same thought about whether RedCap or something like that would make it easier, at least. Like there would be some work to sort of build it out in a way that would be most useful for your team, but whether that would make an easier way to sort of deposit all of that in real time and then have it
And that
there
would
to
allow
work
like
with.
those like nice timestamps for like the longitudinal tracking.
Mhm.
That's a great idea. I can definitely bring that back and think about how we can play with that a little bit more. Thank you.
And I think, Katie, thinking about how often does your team and what members of your team want to access it? And so if it's hey, we actually, look at this a couple, once or twice a month, or, then I think I like Chris's idea of a slide deck, where you can even, how you can have like subject section headers in your slide, and you can be like, this is the March 2026 section, and this is the July 2026 section, right? And then you could have your timestamps and you can, according them down or up. But yeah, I mean, I think anyway, this is another topic for another day, but the conversation around mechanisms, I'm interested to hear the degree to which people are bought into that. I mean, are we bought into it? Anyway, I'm not gonna. I'm a mechanism skeptic. I'll say it out loud, and also, So we can talk about it another time. But Katie, I'm fascinated to hear more about your work and how you're thinking about it.
No, this is helpful. I think it just like how to physically kind of like keep tabs on everything has been challenging. So it's great. And actually I want to learn more about a piece. So thanks for that information too. Appreciate it.
As one more thought, Katie, and I'm trying to picture this visually, but are you using the different forms of the same strategy simultaneously, or are you looking to compare them? It sounds like simultaneously. And this is all, if I'm thinking of the correct project, then is this all at different nursing units, but within the same institution? And so it'd be the same strategy as different forms deployed.
Yep, same strategies. And I think there might be like unit specific, like tailoring that might have to happen too.
I wonder what folks' thoughts might be about kind of duplicating this strategy, and so that each one of them is a unique strategy within the same strategy type, because the way that you're operationalizing it is a little bit different. So then I could imagine it being mapped out if you have like a stem of a strategy, and then it's one strategy which maybe reminders, education, wherever it is that this one is following with the different posts and handouts and things, and then it kind of like branches into all of these different, I would make them different colors, but to each their own, but like branches where each of them is a branch of that same strategy. I don't know. I'm interested in everybody's thoughts on it.
I just dropped actually Molly's table in the chat, and I think Danielle, I could like visualize how like you're just like duplicating each of the forms essentially like line by line, and then adding like your dates, your timestamps, and then your like whatever the visual is or the material is. No, it's great. Thank you.
Yeah, I feel like I've really found one of these existing sort of Excel tools that does everything the way I want it to. So I'm often adding columns or things to capture some of these nuanced pieces that they weren't necessarily designed for, or that are just helpful for our own sort of team's organization. So I think they can be living tools as well in that way. So we have just a few minutes left. Are there any other questions from the group, or any other resources or things that people want to share before we wrap up? This has been a great discussion. Thank you all for participating.
Yeah, I might add, and I don't know everyone's affiliations on the call, but the VA has a lot of really pragmatic tools that they have shared about historically in their cyber seminar series archive. Now, the archive is only publicly available pre-January of 2025, and I'll let you figure out why. And but there are some like really great things. So I think one example that I go back to is a community partnered academic church partnership where they developed an implementation glossary, an implementation strategy glossary, and it like the process of developing the glossary was their foundation for their future partnership, right? And so which was just really, really cool. So I think it's another opportunity for additional tools and resources.
Thanks, Laurel. That's a good reminder. Yeah, the VA has a lot of really great IS stuff for those who can access it. And sometimes they do trainings too that are open beyond the VA, like Allison Hamilton does a great one on like rapid qualitative methods. So we'll try to share some of those as we find them if they're open beyond VA, because they can be really, really good. Awesome. Well, thank you all for joining us today and for contributing to this discussion. It was great to learn about other tools and things that people are using, and to hear about some of the complexity that you all have been coming up against in your work. Don't forget about the special issue Laura Ellen mentioned. If you have anything of your own that might be good to submit. And we will organize and we can send out some of these papers and resources to the attendees afterwards. So thank you all for joining, and we hope to see you back at some of our future PISCE events next month. Next month we'll be doing one about implementation science conferences and how to prepare and present your work. So hopefully you'll join us soon. So thanks everyone.
Thanks, guys. That was great.